Okay, it's turned 4 o'clock. So welcome to our event today, COVID Secure Places of Worship Information Webinar. At this time during the pandemic, we're in lockdown and we're advised to stay at home. We are, however, allowed to leave home for a limited number of specific reasons. This includes to attend or visit a place of worship for communal worship. The session today is aimed at the safe operation of places of worship under the current restrictions. It is brought to you by health, safety and regulatory colleagues from local borough, district and county councils in Warwickshire. Please note that this event is being recorded, so should you remain logged in, we take this as your consent to take part. The information provided today is current and correct to the best of our knowledge on the 19th of January 2021, so please note this if you are viewing the webinar at a later date. The format today will be for our panel to introduce themselves, and then we'll review some of the key issues and topics at the moment, and then open up for your live questions. You can raise your hand or submit your question via chat at any time. My name is Ian Flynn and I work in the Economy and Skills Service at Warwickshire County Council, and I will be your facilitator today. So first up on our panel, I'd like to introduce to you Jonathan.
Good afternoon, everybody. It's really nice to see you all, so many people joining us this afternoon. My name is Jonathan Toy. I am the Group Manager for Trading Standards and Community Safety for Warwickshire County Council. I've also had the great privilege of chairing a meeting of all the regulatory services, Warwickshire Police, Public Health, Fire and Rescue colleagues, on our joint response across the whole county to the regulations, the coronavirus regulations, not just in workplaces, but across our different retail sectors as well. So we're very keen to work with you and share our knowledge today. So good to meet you all.
I'll go next. My name is Gemma Stainthorpe. Hi everyone. I work in the Public Health Unit at Warwickshire County Council, and I'm here to be giving public health guidance and advice today.
Thank you.
Good afternoon. My name's Sergeant Paul Calver from Warwickshire Police. I work within the Harm Hub within Warwickshire Police, but currently seconded to our COVID cell for our COVID response. As Jonathan stated, I've been working with the partners and the regulators within COVID since the pandemic started back in February, March time last year. And I'm here to sort of help answer any questions when I can.
Thank you.
Good afternoon. I'm Daryl Townsend from Warwickshire Fire and Rescue Service Fire Protection Department, here to advise on anything fire safety related, particularly if it's connected to COVID-19 and any of the sanitation and cleaning requirements. So any questions on that, happy to help. Thank you.
Okay, so thanks. That's our panel for this afternoon. So you'll be able to put your questions to them either verbally or through chat. But first, we'll call on a couple of the panelists just to set the scene and give us an overview of what we're discussing today. Gemma.
Thank you. Okay, so yeah, I just wanted to sort of give a brief update of where we are public health wise with regards to the new variant that is spreading within the community, and also the just sort of general numbers and trends of infection at the moment. So I'm just going to share my screen. I hope this works. It's always a bit of a faff because I've got so many tabs open. And if I just go to the right one, hopefully you can all see a graph. Is that right? Yeah, Ian's nodding, that's good. Okay, brilliant. So this shows our Warwickshire cases at the moment, and we can see a trend there going through from May at the very beginning and then over into January now, where we are now. So we can see obviously the second wave, which is quite obviously there at the end of the diagram. So just looking at numbers at the minute, we tend to work on a rate per 100,000 in the last 7 days, and that number is the average that we take. So at the minute, the last publish, it always goes back a few days to get the accurate data, but on the 14th of January, that rate per 100,000 was 369 for Warwickshire as a whole. So just to kind of put that in context for you, we were back in October where things were a lot different. We actually got that rate down to under 100 per 100,000. So just to put it in context for you, the numbers that we are at the moment are incredibly high, and I think that's represented nationally, as we know. And as we can understand, Professor Chris Whitty, when he's saying, you know, we really are, it is very perilous at the moment in our NHS healthcare settings, and also within the community, we are at the worst point at the moment. And you can sort of see, and I will acknowledge that you could argue we're starting to kind of stabilise slightly, but it's a little bit too early to get too optimistic at the moment, and it really is the most important point in this pandemic moving forward. And as Chris Whitty says, it is everyone's business at the moment to try and make this go away quicker. So that's just to kind of give a context of cases and things. So if I stop sharing my screen, that data is available and is provided by our intelligence team, and it can be broken down into district and borough at the minute, and can give you some more detailed kind of numbers on that. But all in all, it's as you know, it's not a great situation that we find ourselves in at the minute. So with the new variant that we're looking at, we know it is significantly more transmissible, and the reason being that we think that it's working in more of an aerosol manner, so it's tending to travel further through the air and be carried further through the air, whereas the first kind of variant of this, it was very much droplet formats, pretty much. So you have droplets that fall to the ground in a shorter distance, and then aerosols which then travel further, hence the kind of really honing down again onto the 2 metre plus social distancing at the moment, and just kind of bearing in mind that this particular variant would respond, you know, the way we can respond strongly to it is to really maximise that social distance and reduce as much social contact as possible. We're in a really precarious position at the minute, looking at our hospital data. You know, they're managing, but just about, and it could take a horrible turn, obviously, if we were to relax too soon. So that's just to kind of paint a picture of what's going on. None of it will be new, I'm sure. And on the back of that, I think our Director of Public Health sent out a letter this month, hopefully to all of you, just sort of expressing her feelings and our feelings around gatherings in general, and what we would support from places of worship. So that's just setting the scene really. From there, I'm going to hand over to Jonathan, because it's not the only sector we're focusing on at the moment, and just trying to kind of speak to a wide range of organisations in a wide range of settings to try and help.
Thanks, Gemma. I'd firstly just like to say a really big thank you to everybody who's on this call, because I know what an amazing amount of work you've all been doing within your communities to support your local communities, support people who attend your places of worship. I've heard some fantastic stories of the amazing work that's been going on. We on the panel, we are not experts in all faiths. We are absolutely not experts in your places of worship. You are the experts on that, and what we're here to do this afternoon, all of us, is to try and answer questions that you might have in relation to issues that have come up, or things that you want to consider, or some of the challenges that you're currently facing. I do want to be clear, though, we are experts in dealing with the regulations, and we are experts in dealing with some of the issues that have arisen in relation to coronavirus. And the new variant has set some real different challenges for us. And as us working in this sector, we have to be very agile to those changes. So some of the things I will say to you, definitely reflect the comments that Gemma have just made in relation to this new variant. And just to remind you, what she said is that the new variant tends to travel a longer distance because it lasts on smaller aerosol type particles, and it's far more transmissible for that reason. When I say it lasts longer, one of the challenges that we are faced at the moment within this is that we are seeing that the distance guidelines that have been given before in relation to 2 meters or potentially 1 meters in certain areas are just really not robust enough to deal with this new variant. And we are very much encouraging people to really start looking at their risk assessments and think about 3 meters, not 2 meters. It's really important that you do that. We've just written to every single supermarket across the whole of Warwickshire, not just the big supermarkets, but every single independent one. Asked them to think about 4 real serious issues in terms of the new variant. One is social distancing. Can they relook at their spatial plans? And can they think about moving to more towards a 3 meter, 2 meters absolute minimum, but more closely to 3 meters, to increase their hygiene arrangements because of the some of the challenges we're still seeing at points of entrance and exit. Also, that face coverings should be worn not just by those customers attending supermarkets, but also by everyone who's working in a public facing area, and increasing in ventilation. Now, I'm sure all of those things will feature within your assessments of your own places of worship. But as Gemma has said, at this moment in time, it's vitally important that we relook at those, redouble our efforts. Think not just about what the space would be for a main area of your building, but how the people you're allowing to exit and enter the building, how those pinch points interrelate and how they play a part, because the pinch points are often things that people tend to forget about. They'll work on the space within a large area of that building, but won't necessarily think about those particular pinch points. And think also about how your communities are attending your place of worship in terms of, are they waiting outside, are they congregating afterwards? All those elements are vitally important to minimise. And as I know, a lot of you have already thought about those or put those things in motion. But I would reiterate that now is the time to relook at them, rethink from the point of view of how this new variant is being spread, and think about the fact that the greater social distancing that we can achieve, the better we have a chance of combating it. So I'll pause there, Ian.
Thank you, Jonathan. Thank you, Jonathan, Gemma. That was a very helpful introduction. Paul, I see you have your hand up.
Yeah, I just wanted to come back with something that Jonathan just mentioned when he was speaking about pinch points and things like that. And one of the main things from a policing perspective, you can understand throughout this pandemic, we have got calls and reports to us on absolutely everything you can imagine, people reporting to us with regard to regulation breaches, isolation, etc. One of the things we have had previously with regards to places of worship is when people exit places of worship and congregate, like Jonathan mentioned. So it's about having that exit strategy from your place of worship at the end of the ceremony or the worship that's going on at the time. It's about having that sort of staggered leaving if possible, because members of the public will ring us about absolutely anything, and it will matter not to them whether it's a place of worship or anywhere else, a shop, a supermarket. If they see a gathering outside, they will ring us. So it's about thinking of those pinch points that Jonathan said, and including the outside space of that place of worship as well, about people congregating and talking outside, because obviously you've still got the spread of the virus when people are congregating outside. Irrespective of any breaches of regulations, you've still got that risk of the virus as well. Thank you. Thanks,
Paul. Gemma?
I think just to follow on from that, really, and obviously I know a lot of you are doing kind of things online at the minute, and just kind of comment that obviously when you go back into buildings and things, it's useful to know this kind of information, and just to really reach out and say that we are here for you. We're here for you all the way, and through, you know, through until hopefully we're all fully established doing what we were doing before. And each of those stages, we're here to help with your risk assessments and to offer advice on things like pinch points, one-way systems, you know, what hygiene you need in place, that kind of thing. So do get in touch and do lean on us, and you're not on your own.
Yeah, thanks all for that. Couple of comments, questions in the chat. One is a question why there's no one from a faith group on the panel, but I think because this invite went out to various communities around Warwickshire, we were expecting to have a variety of faiths represented and leaders of those faiths on the call as guests. And then the other comment was about so St Giles in Exhall, they've moved to an entirely online model for their worship at the moment, but they're grateful for the advice because they can use it when they do reopen. Gemma.
Can I just say as well, just in response to the question around leader of the faith community being on the panel, please do consider this to be a really interactive session. We're not sort of here just to talk at you. Please raise your hand if you want to come in, ask questions. Please give some of your expertise to us, because we equally will find that really useful when we can give you advice. So please feel that you are part of this discussion, and please do raise your hand or write in the chat function there.
Exactly. Thanks, Gemma. I think we'll all get the most out of it if it is an interactive conversation between guests and the panel. So among you on the call, does anybody have any specific questions or comments to raise in addition to what we've already had? Philip.
Thank you, Mr. Chairman. I'm very concerned that you say that the new virus, the new strain of the virus, travels further on aerosols, which are smaller droplets. I wonder if anybody would like to comment on the effectiveness of face masks under these new conditions.
That's a good question.
Yep. So yeah, I can comment, and in a similar way to the first COVID strain that came out, we were sort of suggesting that if people are wearing face coverings in situations where they can't socially distance, there may be an element of, for example, if I'm wearing a face covering, there may be a small element of protection from me transmitting to you, and vice versa. So if you were wearing a face covering as well. But I think the thing to reiterate is, I think we need to cast our minds back to the beginning of this pandemic in general, and the advice that was actually given in the beginning, which I still stand by quite strongly, is that the most effective mechanism is not standing close and wearing a face covering. It is physically, socially distancing as much as you possibly can. And the reason being, you'd rather distance and not even allow that opportunity for the viral particles to reach you than then rely on something that, depending on how you've put it on, how you've taken it off, how clean everything is, you've got that sort of that small element of protection, but I would never ever put that above social distancing.
Thank you very much. Thank you.
Thanks, Philip. Neil, you were next.
You mentioned the responsibility to make sure we didn't have gatherings afterwards, which is that's been my biggest concern all the way along. We've all our services have been done via Zoom right the way through. It's working very well. I've got no intention of changing that anytime particularly quickly. But where does our responsibility end? If I was to resume services, that would be part of the the guidelines I would put out to my people, you know, when the service is finished, you go out the other door that you came in from, go to the car park and go home. Do we still sort of, how much do we need to monitor that? What do we need to do? Where do we stand with that?
Yeah, I'll happily come back with that on this one, Ian. It's a really difficult question and a really difficult problem, and I totally understand that. I mean, I deal with a vast range of areas, you know, one being pubs and clubs and things like that, which, surprising enough, we get exactly the same question, you know. So, you know, it is something we have. It's what we're looking at is looking at yourselves trying to do the best you possibly can to encourage people, asking them to leave, asking them to disperse, etc., etc. You can only do as much as you can do once they leave the threshold of your premises. Fully accept that. You know, we're not asking you to start marching people down the street, etc., etc. What we're looking for is for each area, whether it be a place of worship, a business, or wherever, doing everything they possibly can to stop problems happening, stop gatherings. But you can only do so much. We're not expecting people to start getting into arguments with people. Not that we would hope that would happen at a place of worship, but we're not expecting that, you know, to happen, sort of thing. But if you are having issues or concerns, then, as it's been said along, we are here to help and advise and you know, and guide people. So if when you do reopen as such and you do have that concern or issue, you can speak to one of the team. There's plenty that working with Jonathan's team that do lots and lots of visits to premises to make sure they're COVID secure and advised, and they're there to help. You know, this is what this webinar is all about. It's not about telling you don't do this, don't do that. It's about let's put best practice in, learn from each other and do as much as we can. So all I can say on what you're saying is you can only do what you can do and demonstrate that you're trying to do your best, and that's all we can ask for. You know, it is the police's responsibility to look after public places and public spaces. So if it's a breach of sort of regulations within a public area, so the road, then the police have that responsibility. But they will also look back at where that issue arose from as such, and then be asking the questions, how did you manage it, sort of thing. And if you've, like I said, if you've done everything you possibly can, what more can we say or ask?
Okay, thanks, Paul. Conscious we have a question in the chat, but Daryl, your hand was next, I think.
Thanks, Ian. I was just going to comment on the face mask issue as well, actually. Jenna's dead right about the distance and maintaining that being one of the most important things that you can do. But equally, a proper face mask, if you are going to wear one, or if you think you're going to be in a position where it's difficult for you to control your environment and your 2 meters or more. So if you think that's going to get encroached upon, a fabric face covering is better than nothing, but only just. The ones that are the better version, and something now that NHS and fire are only using IR2 masks or higher. They're not using fabric face coverings anymore for that reason. So used properly and obviously disposed of appropriately when they've been used. They're single use. Break the ear straps as well so that no small animals get trapped in them if they get out of the waste paper bin. Bit like your beer, you know, the beer rings that hold 6 cans together, and then replace it with a clean one. But as I say, the main message really is to use an appropriate face mask, not just a cloth covering. Thanks.
Thank you very much. Thank you.
Thanks, Daryl. Jonathan?
I kind of wanted to come back on Neil's question, if that's okay, because I think it was a really important question, and I think one of the powerful things about having a webinar like this with so many faith leaders on the line is that actually you are able to speak to your community in a way that sometimes we are not able to as regulators or the police. And for us, it's about the consistency of the message that comes from as many quarters as possible. So I suppose my response, Neil, would be your responsibility is to do everything you can to remind people of their responsibility. That's what we're trying to do. And, you know, we are all here to keep everyone safe, aren't we? It doesn't matter what background we come from. We want to keep everybody safe, our communities safe. And I'm an absolute advocate of what Gemma has said. The thing I've seen make the most difference is social distancing. And where we've seen transmission taking the most amount of hold is in confined areas or limited space. It's no wonder that people doing shared car journeys to work have been a common denominator between home and workplace in terms of transmission, because it's a close environment. So social distancing for me has always been the most important thing. And I think some people, in my view, personally, I'm just expressing this, sometimes the overemphasis of face coverings has hidden the importance of social distancing. And the new variant has exposed us to that. So I would definitely say, Neil, thank you for your leadership. Whatever you can do to constantly remind people of their responsibility, you are doing an amazing job.
Yeah, well said. And I should say to all our guests, if you are speaking, do feel free to introduce yourself and where you're from, which part of Warwickshire, which parish, I'll leave that up to you. So next, I'd like to call on Bhagwant. You have a question?
Yeah, thank you. I'm a Warwickshire County and Borough Councillor for the Neat and Bedworth and the Warwickshire County Councillor, and also involved with many Sikh temple in Coventry. My questions are that new variant are more transferable to young children also. But I've seen many children, they don't wear face masks, and I think they may be more vulnerable because their height wise, they're small, and then many fumes and whatever they're coming, they will be more. So what would the law say about the children or outside or in the faith temple or somewhere, and second is I've seen many people don't wear face masks behind the tails, like maybe 50%. I've been to the shops, so although they got a front cover there, but I've seen many, maybe 50%, I think they are without face masks, and because this new variant, they can still pass on to them. So what is the law about that? If somebody don't wear, we can tell them that you should be wearing them or not? Thank you.
Thank you. Several points there. Gemma, did you want to?
Yeah, I'll cover the health side of it, and then I think Jonathan will be really in a good place to talk about face masks and things in shops, because I know we're doing some focus work on that. But just to kind of address the question about children at the moment, it's sort of yes, it is spreading across the kind of the children population as well as the adult. I wouldn't say that anyone's affected probably more than the other, but with regards to kind of with face coverings, I think that the situation with children as well, and I think it's the age of 11. Yeah, Paul's saying good. So from 11 upwards that we encourage face coverings, and that's sort of for a number of reasons around probably around well-being and things as a young child, and also I think when we're thinking about young children wearing face coverings and also social distancing, I think it becomes more challenging because children really want to. They don't always understand how to social distance too well. So I think that it actually becomes more of a problem than the face covering situation, and also with face coverings as well with children, actually putting on a face covering and removing it in the most hygienic way. I'm not 100% sure again that could be fully followed and fully relied upon, that children would pick that up and kind of work with that all of the time. I don't think you could kind of categorise that everyone would be able to do it in the way that we would like. And then obviously if children are wearing face coverings, there's that situation where do they then think that they can run up to their friend because they've all got face coverings on, and then we run into problems with that. So that's just my feeling on that side of things. I didn't know if Jonathan wanted to come in on the other.
Yeah, very happy to. Bhagwant, thank you for raising that question about supermarkets and checkouts. As I said earlier, we took the decision beginning of last week, to write to every supermarket, including all the national chains across the county, because we didn't feel that the current arrangement with staff in public-facing locations within stores should be exempt from wearing a face mask, regardless of where they were working. So as you probably know, there has been a view that if you're sitting behind a screen, that you don't necessarily have to wear a face mask. So if you're on a checkout, conveyor belt type checkout, and there's a screen between you and the customer, you don't need to wear a face mask. That's not our view. With the new variant, unless you're behind a screen which is completely encloses you and doesn't have gaps at the bottom or to the sides, that might be a viable option. I don't know about everybody on this call. I don't know many checkouts within our supermarkets that have that kind of screen. They have openings at the front where you put your shopping, and you have openings at the back where you take it off when the assistant passes it through to you. So we don't believe that the current arrangements are enough. Now, we know the national guidance say if you have a screen up, you don't need to wear a face mask. That's not our view, in the same way that we're expressing the view over 3 meters, not 2 meters. So we have written to all of the supermarkets chief executives, big and small across the county, to say if you are in a public facing position within the supermarket, you're working in that area, your staff should be wearing a face covering. That's our view. It's public health's view, it's regulators' view, and it's all of our view from what we've gathered. And if you look at the SAGE advice that has come recently, that the SAGE advice supports that view. So I completely support what you've said, and that's the challenge we put back to supermarkets.
Thanks, Jonathan. I can see, Eunice, you have your hand up, but I'd like to go next to Gail Phillip. Gail, you've posted a question in chat. Did you want to tell us yourself, or would you like me to read it out?
I can tell you myself if you like. So just to say, my name's Reverend Gail Phillip. I'm the vicar at St Giles, Exhall. I'm also the assistant area dean for the Nuneaton Deanery, which includes Nuneaton and Bedworth. So the question is, I mean, we've moved to online worship anyway, but we do have things like funeral services still happening in the church building. So the previous recommendation was to try and allow us at least a 72-hour gap between each different gathering in the building without doing some pretty intensive cleaning otherwise. So I just wondered, I mean, Daryl mentioned having expertise on this earlier. So do you have any sort of further recommendations about cleaning advice or the gap of time that we should allow?
The cleaning advice hasn't changed much since, I think Gemma's got an opinion as well, but the cleaning advice hasn't changed much other than making sure you clean all hard surfaces and anything that can be disposed of, hand washing being the front end of all of the hygiene recommendations. And yeah, the 72-hour gap is, I think, the minimum considered for hard surfaces, but Gemma might be able to update any new guidance.
Thanks, Daryl. Yeah, so I can. So is it Church of England guidance, did you say, that the recommendation?
Yeah, that's right. Yeah.
Yeah, and I can understand why they've come at it from that point of view, and it is because on surfaces, sort of averagely after 72 hours, the viral load is no longer there and transmissible, really. So that's sort of from that angle. However, there are a lot of settings that don't have that opportunity to leave that amount of time between people kind of coming through. And I think what's really important to just kind of think about with cleaning is when, you know, I haven't heard of the 72 hours being recommended in places of worship. That's a new piece of information to me. I think the most important thing comes down to cleaning touch points and really you kind of need to be looking at it's solutions that I think it's 1,000, but I can't remember, 100 or 1,000 parts per million chlorine. But it's things like your sort of, if you're thinking about your Milton and that kind of thing, your Milton dilutions, that would, I think it's 1,000 parts per chlorine, actually, it's coming back to me, I think. And using kind of those kind of products or products that you know work on COVID, you know, sort of really reliable products and getting into those touch points mainly. If you can cover all of that and think about things like your toilets, having a real deep clean of any touch points again, opening windows and doors and letting ventilation come through, really, really important. And I will mention something about that in a minute. I think once you've done that, you know, you are able to sort of carry on. And I would rather cleaning have been undertaken than not and waiting for 72 hours just in case. Does that make sense?
Yeah, thank you. That's really helpful. Thank you.
Okay. Thanks, Gail, for the question.
Sorry, can I just dive in on the back of that? I know I didn't get my hand up in time, but I couldn't get to the button. Sorry, Ian. On touch points, one of the questions we're getting asked a fair bit, and we've touched on different webinars, are whether fire doors or any doors internally in buildings can be wedged open, and therefore not require people to handle them to open them in the first place. The only answer to that is if they're on automatic hold open devices attached to the fire alarm, yes, they can, of course, because they've already got those automatic equipment on, but you can't wedge doors open with physical objects or door wedges. So I'm afraid it's cleaning comes first. The difference between a regular door you're just passing through and a fire door, if it's on an escape route, most people won't know the difference between the two. And although your fire risk assessor can advise you on that, the complication that can sometimes cause, where somebody can see one door's wedged but another door isn't, you end up having people move the wedges because they think it's a more frequently used door. So we advise against wedging doors, but if you have automatic devices, either battery operated versions or mains powered versions, then of course they're acceptable. I just wanted to touch on that while we were talking about cleaning and touch points. And sorry for jumping in.
Okay, no problem. Thanks, Daryl. Eunice, you've been waiting very patiently. Can we bring you into the conversation?
Well, thank you, Ian. So I'm Eunice Patel. I'm one of the committee members of the Nuneaton Mosque. So we're obviously one of the places of worship that's still open. We've taken a lot of things in place to make sure it can stay open in a safe manner. Our biggest challenge at the moment is an increasing challenge, and I think the question I have is around wearing of masks and the rule of exemption. So I would love to be in a world where I would just say no mask, no entry. I'm getting conflicting information to say there may be a discrimination issue here if I was to do that. Other doctors are telling me that in their GP surgeries they don't allow anyone in unless they wear a mask because they don't believe that there is enough of a reason. So a bit of guidance on that would help us, because we're increasingly getting a number of people who are just claiming to be exempt. Now we're not able to do anything beyond ask the question, are you exempt? That then obviously raises the risk anyway. And with the information you're telling about new aerosol, transmission, that concerns me greatly.
I'll start. Thank you for raising that. I think you're right to be concerned, because we are in as I've sort of mentioned before, we are in a really, really precarious situation at the moment, especially with the new variant. With face coverings, it's tricky, and I think it's very difficult because you can't it puts you in a difficult position when you have to challenge that situation. It puts you in a position for two reasons. Firstly, because if the person is medically exempt, then yes, they are exempt from wearing a mask. And secondly, you're sort of having to then engage in conversation and close kind of social contact yourself at that point, and it's really, really difficult. There isn't a magic answer for the face coverings, and I think even supermarkets struggle. They challenge, and I think it's always good to challenge and ask the question. But again, it falls down to the individual. But I think that is why I really, really feel that social distancing trumps everything, because if you have got people who are exempt and you've got that 2, let's say 3 meters, ideally at the moment, distance in between people, you're cutting that down significantly. I think the other thing I just really wanted to mention with the new variant, and I touched on it briefly, was ventilation. So because this is a strain that is taking advantage of our aerosols and is sort of going further through the air, opening windows and doors, asking people to wrap up warm, and be prepared for the weather is really helpful, because, for example, in a kind of a typical home environment, if somebody has COVID in that home and somebody comes in, if the windows are open in that particular place, the risk of picking up COVID reduces by 70%, which is quite high. So when we're thinking about ventilation with this new variant, it is really, really important. And I would urge you to think about that and social distancing being your main weapons at the moment.
I can concur with that. I mean, we've got the 2 meter social distancing anyway, and we still make people wear face masks, but you can understand the challenge that we've got. I mean, in an ideal world, I would like to just turn them away, but I've been told that from a legal perspective that will be problematic, maybe even from a moral perspective. But I think you've answered the question. So there is no guidance. It is what it is. We're just going to have to live with it. It's difficult, Eunice, but I do think that, you know, it's worth really sitting down and considering what risk that might bring at the moment, and really kind of thinking about, you know, if you are open and you are allowing, you know, and doing that kind of thing, is really taking stock and just kind of going through those risks in your own mind. And I understand it's a really challenging moral situation, and you know, there are lots of other challenges that go alongside that, but it's, yeah, do take the time. Because fortunately it's a very small number. You know, it's less than 5 on a hand, and maybe on a outside of Fridays maybe 1 or 2. Oh, that's so great. It's good for us. But you do get the outsiders, which concern me more than anyone, because then the new people coming in. So, but anyway, we are where we are. Okay, thank you for that.
Thanks, Gemma. Jonathan.
Yeah, I just wanted to come back on the points that Eunice raised, and Eunice, I know just how much you've tried within the mosque in terms of adding extra measures in and the things that you're doing. So again, a really big thank you on our part over that. I think sometimes you just have to kind of celebrate what you're doing really well, you know, and there is a minority, a small, very small minority, as you've highlighted, that you know, doesn't believe or are exempt, won't wear a face mask in different settings. But the fact that you are challenging when you're asking the question is exactly the right thing to do. And if we can ever provide you anything, whether it's something in writing to anyone who's on this call, just those kind of 4 key things that Gem and I are talking about this afternoon, in terms of social distancing, wearing a face covering, ventilation and hygiene, those 4 key areas. If you want us to supply something that you can give to the people attending your places of worship, please just ask us. But if you know you are doing an awful lot, Eunice, and I think just recognise what you're doing. Focus. My advice at the moment would be to focus on the social distancing. What can you do to increase it closer to 3 meters than 2 meters? That will make the biggest difference, particularly in the size of some of the venues that you've had at this moment in time. So that's what I would encourage you to do. And if there are a minority, then I think just recognise you are doing your very best anyway. So thank you. Yeah, just on our point around 3 meters, Jonathan, so we've had an internal discussion. The concern for us is if you open up 3 meters, you open up more of the building upstairs, and then you've got more areas that need to be cleaned and covered and managed. So there's a payoff between the risk of opening up more areas and volunteers. Yes, we have sufficient, but it doesn't mean you can always have more. So we are, at the moment, I think we're going to stay with 2 meters. Like I said, we're still making everyone right. So it's almost 2 meters plus. And because we all face the same way, there's sort of people aren't in a circle. So we have a bit more, and we've got all the doors open and everything's, you can almost access the mosque without touching a thing except your own prayer mat, and leave the same way. So I think we're going to remain at 2 meters. I mean, if obviously the data changes and it really makes it clear that 3 meters and, you know, the risk of that is higher than having to open up more of the building, then yes, I think we would reassess that. But happy to have that discussion offline if needs be. I'd be delighted to Eunice, and it may be, you know, as with other people on the call, you try different things, because that actually then gives you an opportunity to test what works best for you and the people attending the mosque or any of the places of worship. And the offer remains, if you would like us to come out and have a look and walk through with you your buildings, we would be more than happy to do that and assist you if that would be helpful.
Absolutely. I mean, like I said, we've been quite open, and like I say, we'll take all the help we can get. And like I say, if anyone's been to the mosque, they know it's pretty clear as to where you can pray and where you can't pray, and it's been, you know, quite bluntly got sanitizers and everything put in. I guess where our concern is that we've got to pay it off between what's feasible for us, because then if we get too spaced out, then we're going to have a problem around too many areas being used, too many doors being used. And that's a difficult cleaning exercise, and there's a lot more we have to worry about. So, and we're not there for very long. Fridays, even Fridays, we've cut down the timing. So if you think about an average prayer, we're talking about maybe 10 minutes. So, from start to finish, and some people, maybe doing that in 5 minutes and literally come at the beginning and go straight away. So it's been relatively helpful for us. We've not seen any incidents within the mosque that, there's been an outbreak or anything that we've had a concern around. People are generally following the rules because we've basically scared them, said if you don't, we'll close the mosque. That always tends to help. So, so we can do what we can do.
Yeah, and I gather a number of the mosques in London have closed, haven't they? Which sometimes isn't the best approach, because of course, the one of the most valuable points of mosques and all places of worship is they provide a very vital social interaction, and there's a balance that we're having to make. I know Gemma will probably talk more about this in terms of people's own mental well-being, as well as some of the control measures. And of course, you provide a really, really vital link in terms of that social and mental support. So again, from our part, a big thank you for that.
I can see Paul's on the call, and I'm sure he can come in. But one of our big concerns is if we were to close the mosque, that then opens up the possibility of people holding clandestine prayer meetings. And we know that did happen in lockdown. So when the mosque was shut, people started doing various things, and it wasn't only the Muslim tradition. The Christian churches, people were doing things in different places, and that for me would be a lot worse, because that would be unregulated. I can guarantee you that. We know there's a current one that's going on at the moment, which Paul, I'm sure, is aware of, and it's quite difficult to manage. It has been able to shut it down because of the difficulty of almost tracking them down. We've had an issue with the person at the mosque, and that's being dealt with at the moment. But my bigger concern is if I was to close the mosque down tomorrow, and without the legal precedent to say you must shut it, I can quite easily see a backlash from the community, and then people just saying, well, I'll do my own thing. And I'd much rather they did it in a sterile, in a much more confined, regulated manner.
Agreed.
Yeah, I mean, just from a police perspective on that point, totally agree with you. I think one of the bigger mistakes of the first lockdown was the closing of places of worship and things like that. So, and we did have the issues that you mentioned in the first lockdown. So, I'll go back to what I said at the beginning. We're here to support everybody, no matter the faith, the location of the district, the county, or whatever. We're here to help and to make those places of worship as safe as possible for your communities. We're here to support you. So we're not asking anybody to close. We're here to support you and asking you to work with us so your community and your attendees are safe as they possibly can during the pandemic.
Well said. Yeah, thank you, Paul. I'm conscious we've got a couple of questions in chat and a couple of hands up. So if we move on, Yassine, can I bring you into the conversation?
Hi, Ian. Thank you very much. Yassine, also from the Nuneaton Mosque. Just sort of continuing from the questions Yunus asked, the 3 meters that we've spoken about, is that sort of advisory from Public Health and the partners in Warwickshire, or is that nationally? Because obviously we're in constant communication with places of worship and leaders at mosques across the country through WhatsApp groups or social groups, etc., in terms of everybody's bouncing off each other in terms of good practice or something that somebody's come across and we may not have thought about it, and constantly looking to improve. So when we're talking about 3 meters, colleagues in Coventry or colleagues in Leicester, for example, the 2 nearest cities to us, they've heard not much about the 3 meters, if anything at all. That's one thing on the 3 meters. The other thing is where we have a prayer time and people are coming in, if there's a bit of a queue building up, we've cordoned off a part of our car park. So how you had queues outside supermarkets, cordoned off areas. So similarly, we've got cordoned off area. So is that if the 3 meter thing became if 3 meters became something that we had to then do, or we all moved towards, then would that 3 meter distancing apply across the board? So queuing up outside to your space of prayer within the building as well. And I'm just going to throw my third question out as well, is where places of worship choose to close voluntarily, because that is what would happen at this moment in time. where do those places of worship stand in terms of individual worship, funerals, etc.? Just if you can provide some guidance on that, for everybody.
Yeah, thank you.
Shall I start, Ian?
Jonathan, yeah.
And then rely on others to come in. So yeah, Yassine, good to hear from you. And just in response to the 3 metre point of view, you're unlikely to see much in government coming out from central government in terms of 3 metres. You'll hear a lot about a minimum of 2 metres now, not just 2 metres. And what we've looked at from a Warwickshire perspective is we've looked at the SAGE evidence on the new variant, and we've looked at the stuff that Gemma was talking about before in terms of transmissibility and how it is spread. And we feel very strongly that people should be working towards 3 metres, with 2 metres an absolute minimum. Now, if you're in an outdoor setting, the risk of transmission is slightly less because, of course, you're in the open air. As Gemma said earlier, ventilation and lots of air movement helps to disperse those aerosol particles more quickly. But I would also say, and hopefully Gemma will agree on this, we don't want people to put their guards down because they're outdoors rather than indoors. We are equally concerned about outdoor transmission, which we've picked up in some cases recently, as well as indoor. So it may be in terms of the areas that you've marked off, Yassine, outside, that 2 metre distance is fine. I mean, our advice, both Gemma, mine and Paul and Daryl's, would always be try and make sure that those queues are an absolute minimum. Try and manage them, don't let them build up. Because again, that in certain locations has seen problems being caused. In terms of individual prayer, the regulations allow for an individual or household to carry out their own prayer. Okay, the regulations are very clear on that. So you can attend a place of worship for individual prayer or prayer within your household bubble. All right. So that hopefully is a fairly straightforward answer. It depends on obviously how you in terms of running your place of worship want to operate that. But our view, say it again, in terms of Warwickshire, is work towards 3 metres, particularly for indoor settings, as best you possibly can. We know it won't always be practical, but that is our strongest advice.
Thank you.
Thank you. Gemma?
Yeah, I think just to pick up on that as well and reiterate, with regards to 3 metres, I think, what we're kind of saying is, whereas we've had a lot of guidance, through the summer, etc., that was, 1 to 2 metres, I think what we're saying is really now is 2 to 3 metres, and please try to go, above 2 metres if you can, because we know that social distancing is so powerful. When you're coughing, if you have a sneeze, if you cough, it goes way further than 2 metres. So I think it's just a case of really trying to manage that, but also just kind of bearing in mind with distance. I can't remember who it was who said in the news, but it was either Matt Hancock or Chris Whitting, I can't remember. He was saying the way to reduce the spread of this virus is to behave as though you have it. And I suppose my question is, if you think that you have it, would you stand at 2 metres or would you stand at 3? Because I know that I would stand at 3. So it's just to try to make you work to 2 metres plus, and to try to really kind of hone in on that, because we know it works. I hope that helps.
Okay. Yeah, thank you.
Thanks, Yassine, for the further question, and Gemma. So, conscious of time, we do have a few questions and comments. Leanne, would you like to come into the conversation around your comment?
Yes, I'm the volunteer coordinator for the Catholic Church in Nuneaton, Our Lady of the Angels. We've been having daily mass since the resumption of public worship last July. I know that Sir Edward Lee put this question in Parliament, but have we got the data of any evidence that places of worship contribute to the spread of the virus, because we've found in our own parish the needs of the people to be able to still attend has been, you know, a lifeline for many. And I think when people you start saying, oh, you need to start doing this, this and this, adding on to things that we've already done, you're creating a fear culture. And we have a lot of elderly come. Now, you know, we follow all the guidelines. We have strict social distancing and cleaning after every mass, and we follow everything. We have a track and trace. We've not been made aware of any positive case from within the public worship setting. Is that data available? Because sometimes it's good to have a positive message to give to people, that actually coming to mass, coming to a place of worship is safe and should be encouraged if you're able, because, you know, there's a lot of negativity out there, and I think as places of worship we offer a lot of hope to many. I mean, we have people, not just Catholics, coming to our church, other denominations, as it's a safe place, a place where they can come and pray. So is that data available, just to be able to put people's their mind at ease? And as I said in a comment, you know, if there's other places of worship that are considering having, you know, going back to having public congregations, if they want to chat, we as a team, we are more than happy to help, you know, show how we manage and how we keep our daily masses going.
Thank you, Leanne. Is that your hand up, Gemma?
Yeah, I'll try and be quick. I know we're running out of time. Firstly, Leanne, thank you for all of the work that you've clearly been doing to make your place of worship COVID secure. If you haven't had any outbreaks originating from it, that's fantastic news, and you've obviously been doing a great job. So that's really important to just recognise, and just to say that the data side of things, I can go digging for you, but the fact that you as a place of worship haven't had, as far as you're aware, any positive cases, you know, feel reassured about that. Talk to your congregation about that, and just kind of say, you know, these methods that we've put in place have been keeping you safe and will continue to keep you safe as long as we're all kind of following together. And I think there's a way of obviously phrasing that obviously, because we don't want to be scaring people to death, but we need to kind of appreciate the fact that good work you've put in has probably made quite a difference. And I think it's just kind of remembering that. And just kind of thinking about all of those measures and taking them forward. But that's really good news. And yeah, and you are the example if that's the case, and do speak to your congregation about that.
Okay, thank you. Bagwan, I can see your hands up, but there's a question, a comment from Mary, St. Mary's in Warwick.
No, it's the quick question about the cleaning touch points. And like our temple is open from 6 o'clock in the morning to 7 o'clock, and the people coming in and out, not getting together, but they are coming all day. But what are the touching point? How long when you disinfect or clean the touch points, they are effective, you know? Otherwise they will be cleaning all day, or 10 minutes or half an hour, anything. How long it is effective, the touch points? First thing is, and second is when after the funeral in the temple, the people sit on the floor, and then they may be staying for 1 hour, 1.5 hours, although they're sitting 2 meters away. But when they leave the temple, and the temple is open again for the general congregation, for individual worship, so what guidelines are to disinfect the area, or what they should be doing? These are the two. The other thing is when we're going into the shop or a store, we put the gel inside going there. Then when we come out, we do again. So they're doing too many times, like putting gel on the face. There may be more antibacterial material on your body that may be, whether may be harmful or not. So is there any guideline, like once you put the chemical, when you're touching the stuff inside the store, but it's still effective, or how long, or like something, like a general question. Thank you.
Sorry, was it that from Bagwans?
Yeah, that's right.
Yeah.
Okay, I have pasted a link in the chat here for cleaning for non-healthcare settings, and that's got a lot of really good information in Bagwant. So if you want to have a look at that and just have a read through, and if you've got any questions, then please get back in touch with us and we can help give you some more advice. Obviously, you know, with touch points, you want to be doing it at least daily, depending on how many people are coming through. And just to kind of say, you know, once they have been cleaned, there's no guarantee that then that surface then remains protected necessarily for any amount of time if the next person touches it who has virus on their fingers. So it's just about being mindful, but please have a read of that, and if you need any more help, come back to us.
Yeah, Bagwan, if anyone else on the call, if you want to get in touch with anybody on the call today, if you email business@warwickshire.gov.uk, business@warwickshire.gov.uk, then we'll forward that on to the right person. Mary, are you still on the line from?
Yes, I am. Hello.
You had a question about choirs, I think.
Yes. St Mary's in Warwick is used a lot as a concert. We've made the decision not to open for services except funerals during this lockdown, although we were open whenever we were allowed last year. I'm getting quite a lot of requests from professional choirs who are legally allowed to rehearse and record about whether they can use St Mary's, and I'm kind of dubious, really. I haven't said yes, and obviously I would have to go to the vicar anyway and get permissions, but I wondered whether your experts had any guidance or feelings about whether allowing a choir, albeit a socially distanced one, into a building to sing in the evenings, which is then going to have a few members of staff in it the following day, is sensible or not.
Jonathan, you've got your hand up. Do you want to go?
Sorry.
Is that all right?
Yeah.
I read your message in the chat, and my mind went straight to my daughter, who's a musician, and of course they're doing all of their ensembles online. They're not going to any venue at this moment in time. I think you have made. I think what you've said about not allowing it right now, my view is that's the right decision. I would absolutely agree that that's the right decision. I think we know that singing, that increased flow of air does have an impact. And again, you know, if you're in an inside setting, I would absolutely say your decision not to hold them right now is right. I don't think we'd have any problem, either Jem and I, to give you the heads up on when things are looking better, and that you might be able to think about bringing those things back in, but I'm not sure it's right now, and I would certainly be saying don't do it.
Would you be willing to provide some sort of documentation from Warwickshire to that effect, because we have to battle every single guideline when it comes to worship or performing arts, basically, because we are asked to push them to the limit.
Yeah, and it's a real challenge, isn't it? And as I say, you know, it's very close to my heart because my daughter's a musician. I know just how difficult it is at the moment. But many of the national orchestras that she's involved in are just not meeting now. They're just not. They're doing everything online. They're even doing sectionals online. They're not going to venues. And they'll plan for things, you know, probably post March. So yeah, I'm happy to drop you a note, Mary, or I can share it through the whole group if that's agree with everybody. You know, yes, the regulations would allow it, so the guidelines would allow it, but right now I don't think it's the right thing to do.
Thank you.
Thanks for the question. I'm conscious here in chat there's been some requests and promises to provide information. We don't actually have the email addresses of the guests on the call, so if you do want anything specific, such as the letter that's been requested, could you email business@ with your details so that we can get back to you with that, please? So thank you. There's also a request for a mental health related webinar, which I think perhaps we'll look to do.
Yeah, definitely. Yeah.
Okay, we are past 5 o'clock. Do we have any questions? Father Stephen.
Hello, just to say that the Church of England has very clear guidelines on professional choirs not using our buildings at the moment, and that's all available on the Church of England website. So Mary, if you're struggling with groups wanting to use St Mary's Warwick, you just need to forward on the Church of England guidelines, and that will fight the battle for you.
Thank you, Father. Jonathan, is that a legacy hand or?
Well, it's partly legacy hand, but I'm more than happy to give Mary cover on this one. So I will do you the letter, and then again, happy to share it with everybody else, just in case. It's always best to point at the regulators. That's what we're here to do. So very happy to do that.
Yeah. Okay. I don't see any new questions. So as I say, if we've promised you anything in the chat, do please drop your details to business@warwickshire.gov.uk. Louisa, is that your hand?
Yes, Ian, sorry, there was a question from Gail with regards to people being vaccinated and right, that they may feel things are safer, but we understand that we don't know if this reduces the risk of transmission, and I just thought that that was something that perhaps needed to be put forward to panel.
Thank you.
Yeah. So obviously with regards to vaccination coming through, so I haven't seen that query, but with regards to vaccination coming through, until there is a national movement and until there is a period in time where the vaccinations have gone through as many priority groups as necessary to warrant change, we should all still be being really careful, because obviously we're going to go through this period where some people are vaccinated, some people aren't, some people have had one, some people have had two, and it's a really precarious situation. We don't want to kind of take liberties with that. So just to kind of carry on, it will become apparent, and I can't wait for the day, to be honest, but it will become apparent when things change, and that will be apparent to everyone.
Okay, thanks, Gemma. Yeah, there's just I think Jonathan, you've dealt with Alan Smith's question, so I think we're done for today. Would any of our panel have any final comments, or?
Ian, can I just very quickly say a big thank you to everybody. We've done lots of these webinars for many different areas of regulations, businesses, communities, etc. Big thank you to everybody that's attended this webinar, because it's a really good turnout. Some really good questions, and we are here to be challenged as well. So, you know, there's no problem with challenging questions, etc. But we just, you know, for me personally, just like to thank you all for attending, and also all the work you are doing in the community, because it is needed. You know, we are in difficult times where people do need people to talk to, support, welfare, etc. And all you are doing such a wonderful job within that area. And we are here to help you keep those people safe with you. So, you know, please, like I said before, you've got the email address. If you've got any questions, please contact us. We are all here to help. I just wanted to say a big thank you to everybody for joining.
Jonathan, is that a new hand or an old hand?
It's a new hand. I was equally going to pass on our thanks to all of the faith leaders on the line and those from different organisations. I know Alison Thompson's on the call as well, who does a fantastic amount of work across Warwickshire Carver. We often hear about the work you do with your communities and the support you do, and I've heard lots of testimonies in the last few days of some of the fantastic work that's done through the mosques and the churches and the temple. So a really big thank you for that. We've got some very vulnerable people out there, and the point was made about getting the balance right. About, you know, we know the risk, but actually we need to support people, and we find that balance quite challenging. From our point of view, because we do want to protect people, but equally we know that people are isolated and socially and mentally very, very vulnerable. So I think the idea of doing a webinar on mental health is a fantastic idea. And I just want to say again, we are absolutely here to support you. If you ever want any advice, want to come to us and ask about your place of worship, want us to do a walkthrough, virtual or otherwise, we are there to do that for you. So please just ask. And a big thank you again.
Okay, and thanks, and my thanks to our panel, colleagues from the county and also the police and fire service. We'll post up some useful links at the end, including that email address which is in chat. But thank you very much, everyone, and stay safe, and hopefully we'll be out of this terrible pandemic soon. Okay, thank you.